Next one is the active immunization and migration of people you have to control. So like the migrant people, so some of the countries they need the forms that you are already done immunization for what, you know. I think some of the countries, if we want to go, we have to fill the forms. Now I already finished the immunization for hepatitis D, you know, like the cholera, typhoid. Some of the diseases they dislike, they want to fill the forms. So what about the control of cholera outbreak? These are the notifications. One of the notifiable diseases you have to notify, and then you have to verify the diagnosis. Third one is reporting to the higher authority, enter to the WHO, and then hospitalization of the patient. We have to isolate the patient, but quarantine, no need for the quarantine for the family members. No need. And disinfection by heat, carbolic acid, and other disinfectants. And disinfestation by adequate fly. You can do the adequate fly control because this one is mechanical transmission of the diseases. Early case finding and treatment. This is based on the symptoms, and also you can give depend on your current trend. These are the antibiotics. No need. So epidemiological investigation. We are talking about this issue in the year 4. One topic as the outbreak investigation. You know, for all the communicable diseases. These are sanitation measures. Say this chemoprophylaxis is based on your country interest. Some of the countries they are not doing chemoprophylaxis. Some they are prefer based on your Ministry of Health. You know, they are prefer or not. Another one is health education. Cook your food, boil or chlorinate your drinking water, and wash your hands. So we are thinking this question is boil or chlorinate your drinking water. Now we are here, we can do it. But for the disaster, very difficult. Where is fire? You know, where is gas? Where is the microwave? So where is the chlorine? All are gone with water, not wind. You know, gone with water. So on that time we care how to do. So security. Emergency, you know, we have to survive, support the logistics to the affected area. Otherwise, more than 7 days, we cannot survive for a long time because of the young and old age. This is very important. So, because in our country, we have experience about the Nugget, you know, Nugget cyclone attack, is it? All the people are gone with water, and some of them are climbing to the palm tree. You know, palm tree are very high. So palm tree, they are climbing, and then they are holding the palm tree. So they are family. You know, my mother, daughter, husband, you know, all together climb up, and then they are touching the palm. But water is, you know, like the tide. The whole water coming, and then also drain. So on that time, the whole day, you know, how many hours they are doing like that. So finally, they cannot hold. And then some of them, they are give up. They give up, and then they pass away. So, but I met the patients. They have a lot of abrasion here, you know, abrasions. And then he survived. I think he is 9 years old, once. And then he told me, my mother, because, you know, on that time they are studying by one. He is the first one. Because he is 9 years old, I think in the village, you know, they are very clever for climbing. So, and then her mother is pulling her foot. So finally, he suffering pain, and then her mother said, I cannot stand anymore. If I pull you anymore, you will also pull down. So, please let me to escape. So the boy, he's suffering a lot of abrasions, you know, because on that time I went there for treating the Nugget attack patients. We are going there. So they told me the history of their problems. You know, a lot of history there. So very pity. You know, they say they think only 1 or 2 hours finish the day, but 1 or 2 hours finish every day. Nobody alive. Maybe a lot, more than I think 1 million or maybe not. We cannot get the real data. because government did not announce on that issue. So the sister, we are afraid. So this time here is we already announced. The water level can be high. Please, you can prevent yourself. You can go somewhere, something like that. This is a pre-announcement is better for the victims. So food poisoning. Here also food poisoning next one. So where the incidence of food poisoning in Malaysia from 1996 to 2006, which state is higher? Kelantan. It's also here Sabah 818, 6.29, 5.5, but until here is Kelantan 24.7, 7.5, 58, 4.9. This is the food poisoning that I already showed in the previous slide. So definition of food poisoning is what? So by means of toxins or by means of bacteria, this we can suffer the food toxins, food poisoning. So this one is food poisoning has one characteristic, that is a history of ingestion of common food. Now your group are invited, somebody is invited you to come to her home for Christmas Eve. After that, come back in your mahala, 10 of the students are going there, among them 5 or 6 students suffering abdominal discomfort, maybe nausea or maybe diarrhea. So this is, we call it we know this one is a food poisoning. Not typhoid, not cholera, may not be cholera, may not be cholera. But you have to think, food poisoning can cause by the bacteria or by toxins. Maybe because of typhoid, because of paratyphoid, because of cholera. We cannot know within one night. So how will you distinguish this one? Is it real food poisoning or is it by means of bacteria or by means of toxins? So here is a following table summarization. Characteristics, infection versus intoxication. So this is, if you understand, maybe year 1 student suffering this one, you can say year 1 student, oh, I know this one is because of toxins. No need to go anywhere. This is because of toxins. This is not bacteria, you can say. So how to say this one? So organism is for the infection like bacteria, virus, parasite that we mentioned about, typhoid, paratyphoid, cholera, and maybe yes, something like that. But another one is toxins, chemical toxins. So how will you describe? Here is incubation period. From hours to day, intoxication is the toxin is minutes to hours, very quick. Sometimes you have the DDT, for the insecticides. Insecticides now we are using in the field. So they are using this one for killing the insect. But this dose is high dose. This is lethal dose to us. But the farmer not know. They think, no, I spray this one, all the insects are gone. So I think this one, if I put higher, they will die more. They think like that. So they spread a lot. So because of that reason, all the cabbage, maybe cabbage, carrot, some of the things have the contaminated toxins. Now we are not washing very well this vegetable, and then raw, you can eat raw without washing very well, you will get the toxins within minutes to hours. So another one is here, fever or not fever. That's all. Okay? Fever or not fever. In the bacteria or maybe virus or parasites or infection, we call it. Infection has a fever. Okay? This can be spread person to person via fecal oral route. This one is not communicable because of the toxin. So this is because of what? Inadequate cooking, cross-contamination, poor personal hygiene, bare hand contact. This one is inadequate cooking, improper holding, and temperature set. But here is because of hygiene problems. This one is because of the underlying toxin problems. So difference is only two things, fever and hours. This is important one. It's a danger zone. Now we are, before cooking, we have the raw material. We are putting in the refrigerator. Is that right? Refrigerator. So refrigerator have the two portions. Upper part is cooling and freezing. Freezing. So we have to put in the freezer, not freezer. Freezer. Okay. Freezer before cooking or after cooking. Freeze. Okay. If you cannot freeze, there will be contamination. Bacteria will multiply very beautifully. They are very happy to grow. We can meet each other, female and male, or maybe one by one multiplication, and there's a lot of growth. So this is what level is safety zone. What level is the danger zone? Here. Here is the multiplication. Okay? Multiplication of bacteria from 4 degrees Celsius to 60 degrees Celsius. Or otherwise, 40 degrees Celsius to Fahrenheit to 140 degree Fahrenheit. 40 to 140. Is it? So, if you want to freeze, you have to freeze here under 4 degrees Celsius. It's safety. Or if you want to eat again, you put from the freezer, and then you have to boil or maybe heat again above how much? 140 degree Fahrenheit or 60 degrees Celsius above with the microwave, or maybe something like that, by fire or gas. So without heating alone, there will be also multiplication there. So sometimes we are very boring, We are very boring to reheat. Right? So you are taking, and then you also don't want to put, you are cooking, and then after cooking, you don't want to put to the freezer. You just put in the upper part. Is it right? Am I right? Yeah. So because you think, if it is freeze, very difficult to reheat. That's why. But because of that problem, we are suffering. Because of this danger zone. Be care of this danger zone. This danger zone is we are learning in the master. Now, but I share you, this one is here. So because of this one is very public health problems for all. For the student life is better, you have to know better, If you are not freeze, multiplication. So this is they are not, the bacteria dislike, Here also they dislike, here they like area. But they like, we don't like. Okay, the last one is the viral hepatitis A. This is the infectious hepatitis and acute inflammation of liver disease. The common this one is very common in all over the world, and the major health problems in developed and developing countries. This is WHO incidence rate is 10 to 50 per 100,000 population. How about Malaysia? Okay. Yeah. So this is the Malaysia problem. In 2010, Malaysia 1,415 cases. Reported cases. So incident rate is 5 per 100,000. Among them, hepatitis A is 39 cases. These are the all viral hepatitis. 5.0 per 100,000 in all VH. Hepatitis A, B, C, D, E like that. Among them, VHA is 39 cases concerned in this IR. So endemic is some states such as Terengganu, Kelantan, and Sabah. So sometimes if you are not remember very well, you can use this link. Kelantan, Sabah. Is it right? Most, but don't do like that, In my question, I'm asking this one of you. Okay. Most cases occur at border area, like Sabah, Sarawak, Kedah, Perlis, Perak, and Johor. So why they have the higher incidence because of the border area. Border area very difficult to control. Right? This is 2000 to 2011 incident rate of hepatitis A in Malaysia. Okay. Now decline. Very happy. 2005 okay, 7 okay, but 2011 died. Then up. Okay, 2011 there is also outbreak there. So this is the outbreak onset, presented with fever, malaise, anorexia. The most common thing is what? Viral hepatitis, the symptom, sign and symptom. The most obvious is what? Jaundice. What is the jaundice? Yellow, discoloration of what? Skin. Yeah. So how do you know how the physician check your eyes? Up or down? Now how to check the anemia, how to check the jaundice, it is different. Okay? Now if you are going to the clinic or hospital, you know how the physician check. Anemia and jaundice different. You are looking the eyes, but you have to know. Please take note this one. Anemia and how to check the anemia, how to check jaundice. This is different. Okay, this is the epidemiology. Agent is viral hepatitis B, viral hepatitis A, resistant is they are resistant to heat and chemical. And then 60 degrees Celsius for 1 hour with formalin inactivated by UV light. The reservoir and chimpanzee and non-human primates. The infected material also water, food, milk, feces and urine. These all are not so different, or they are nearly same. So motor exists figure already by means of feces and urine. So all the age more in the adult. Gender, there is no difference between gender to suffer this viral hepatitis A. The pregnancy has the more prevalence to get the viral hepatitis A and they will be severely high. Environmental factors are same with the other diseases. And then mode of transmission is a figure or a root. Same. Is it right? And then they have the sexual transmission. There's mainly homosexual transmission. Be careful of this point. There is a viral hepatitis A can be transmitted by homosexual transmission. So prevention of viral hepatitis A by means of education. This thing. How to make the environmental sanitation, water sanitation, HP done, blood train, food, and then there is the pest control measure, fly proof, and also the hand washing personal hygiene. And the proper sterilization of syringe and needles. Now we are afraid of this share needles for the healing addicts. They are using their share needles. Now hepatitis A prevention by means of immunoglobulin pre-exposure. That means that pre-exposure means if you want to go somewhere, there is a high incidence area. So we have travelers to intermediate and high hepatitis A virus endemic regions. Next one is the post-exposure. Now you are coming back from that state. If you are afraid, you can take this one after coming back from the endemic area. So this one. That's all for next one. I have made the break. So what are the questions? It's very difficult because all the 5 topics. I take one topic for 1 hour. But here, your curriculum combine all. So I have to. But please make notes yourself by one. Okay? Any questions? Okay, no questions, you can go out for 5 minutes. And stand up all stand up. All stand up.